Hi, this is David Holt, IV consultant. Should be a short video on how to use Holt's IV rule number 2. This is not a trick to make sure that you get to the bathroom on a regular basis, perhaps daily. Perhaps I'll make a video with 5 or 6 tips on how you can do that. But today's tip is how to give a full dose of IV antibiotics, some of which do cause diarrhea, but this is how to give a full dose of IV antibiotics when the bag is 100 cc's or more. Holt's rule number 2 is as follows. You add the following items: the volume stated to be in the bag, plus a presumed overfill, which is 10 to 15% of the volume in the bag, depending on the manufacturer. If you assume 10%, you'll be fairly safe, plus the mainline IV tubing, which is usually 22 cc's, plus the secondary IV tubing, which is usually 8 to 10 cc's, plus any additional add-ons such as an extension set or the central line catheter dead space. Now, during the COVID situation in early 2020, TV showed, the news shows showed nurses saving on PPE, protective equipment, by setting up their IV pumps outside of the room. Now, in that situation, you will almost certainly need to use 2 mainline IV tubings setups because the IV pump is so far away from the patient. So in that case, you've got 44 cc's of dead space with your 2 mainline IV tubings, one after each other, plus your secondary tubing. So that will make a substantial add-on to your volume to be infused calculation. So the volume to be infused for your IV pump will be 100 plus 10 plus 22 plus 8 to 10 plus all your extensions, and that is going to come to substantially more than 140 cc's. In the case of the COVID ICU nurses or the nurses looking after COVID patients, it'll be an additional 22 cc's, which comes to about 165 cc's. If you do not program an appropriate number in the volume to be infused, the antibiotic will still be in the tubing when you stop the IV pump. Very often the ICU nurse is using individual giving sets for each medication because they're concerned about inter-reactions. If they would flush back to clean the tubing out, you could use one secondary piggybacked appropriately into one mainline, even though you probably have TPN going into a second catheter and other goodies going into these very fragile people. You should be able to use a true 2-tubing IV system and not have 5 or 6 different secondary tubings hanging with old medicine bags on your IV pole. So Holt's IV rule number 2 is not to help you poop. It is to help you give a full dose of IV antibiotics or other medicines such as vetiver, magnesium, potassium riders, and the like. So look it up if you need more information, watch another couple of videos, and enjoy your nursing.